Assalamu alaikum. My name is Murtaza Juzer and our group is 15. The topic assigned to our group for presentation is bipolar disorders. And bipolar disorder is a type of mood disorder. So we will first discuss a mood disorder, which is a mental health problem that primarily affects a person's mind state. It is a disorder in which a person experiences long period of extreme happiness or sadness, or even both. Mood disorders are capable of changing a person's behavior and a person's state of mind, and his or her daily activities and routines. The two most common types of mood disorders are depressive disorder and bipolar disorder. And our topic is bipolar disorder, so I am going to discuss that. Bipolar disorders that are also known as manic or depressive disorders. These are the disorders in which a person experiences mood swings and periods of depression or manic episodes. Depression is when someone experiences a lowering of mood, and if that person experiences that low mood for a longer period of time, it is known as a depressive episode. And a manic episode is that in which a person may feel elated or is hyperactive in nature, or also feel irritable or have increased levels of activity. There are four basic types of bipolar disorder: bipolar 1 disorder, bipolar 2 disorder, cyclothymia disorders, and other bipolar disorder which are caused due to mostly drug abuse. My topic is bipolar 1 disorder. So bipolar 1 disorder is more severe type of bipolar disorder among the other types. It is also known as manic depressive disorder or manic depression, and it is known so because in bipolar 1 disorder there are more number of manic episodes than there are depressive episodes. So that's why it is known as manic depression or manic depressive disorder. In bipolar 1 disorder, a person affected is it is necessary for a person to be said that he has bipolar 1 disorder, that if he has at least one manic episode in his life. And the people with bipolar 1 disorder also suffer from episodes of depression, but the episodes of depression are a little bit suppressed as compared to manic episodes. And often there is a pattern of alternations between mania and depression. So the drugs used for the treatment of the bipolar 1 disorders are basically some mood stabilizers, antidepressants, antipsychotics, and these classes may be used individually, or either they are used in the form of combination therapy. So we will discuss them. The first class is mood stabilizers, which is very commonly used in the patients with bipolar 1 disorder. These are used to control the manic episode or hypomanic episodes. This includes lithium, valproic acid, carbamazepine, and lamotrigine. These all can be used individually, as I said, or they can also be used with each another as a combination therapy. Then the second class is atypical antipsychotics. These are used to control the symptoms of both mania and depression, and these include olanzapine, risperidone, quetiapine, and aripiprazole. And the third type, which is commonly used for the treatment of or management of the bipolar disorder 1, is antidepressant, which are used for lowering the depression state, and these includes citalopram, fluoxetine, and sertraline. Now the treatment strategy for bipolar 1 disorder, as we know that to differentiate between bipolar 1 disorder and bipolar 2 disorder is a little bit difficult, because both the states include same both disorders, both types include manic episodes and depressive episodes. So it is a bit difficult to differentiate between their treatment strategy. So what we have to do for their treatment is, in bipolar 1 there are more manic episodes than depressive episodes, so we will have to manage the manic episodes more. And for that, we will give anti-manic drugs and antipsychotic drugs and mood stabilizers. Then rather we will give the antidepressants. And the treatment has generally of mood disorders or bipolar disorder generally has two treatment phases. First is the acute phase treatment, uh, which is used to, or necessary for the ongoing current situation of the patient. And then there's maintenance phase treatment, which is used to avoid the relapse of the patient condition. So these are the acute phase and maintenance phase. Now the treatment for bipolar 1 disorder, as I said that manic episodes and hypomanic episodes are more common in bipolar 1 disorder and are in high number than depressive episodes. So we will have to majorly control the manic and hypomanic episodes. So for that, we can use mood stabilizers as a monotherapy, or as I said, it can also be given in combination, sorry. So mood stabilizers are used to control the hypermanic or hypomanic condition of the patient. And these include lithium or lamotrigine or carbamazepine and other drugs as well. Then there comes a class known as antipsychotics or atypical antipsychotics, uh, more specifically. These are given to control both the symptoms of manic episodes and depressive, but if there is psychosis in patient observed, then this class can also be given. And these includes quetiapine and olanzapine and other drugs as well. Now combination therapy, as we discussed before, combination therapy is of two types. One is in which a mood stabilizer is given with another mood stabilizer, and one is in which a mood stabilizer is given with a atypical antipsychotic. So the first one is used as a first line and second line treatment for non-psychotic mania, in which there is no psychosis observed in the patient. And the other class, in which there is a mood stabilizer given with an antipsychotic in a combination therapy. So this combination is more rapidly effective than the monotherapy of either an antipsychotic or either a mood stabilizer. And then the third class, which is used to manage the depressive episodes, which are also occurred in bipolar 1 disorder but in less amounts, comes the antidepressants, and they can be used as a monotherapy, or they can also be used as a combination, in which there is a very common combination used to manage the antidepressant episode, to manage the depressive episodes in bipolar 1 disorder. That is the combination of olanzapine, that is an atypical antidepressant, and fluoxetine, which is an antidepressant. Now this was whole the acute management of the bipolar 1 disorder. Now we come towards the maintenance therapy. So the maintenance therapy is is usually for avoiding the relapse of the patient. And for that, also those medications are given which were given in the acute phase, but only the doses are changed, and the frequency of the giving the medications is also changed. And there is a case study in which I will briefly explain that there is a subject which we will call B. Is a 40-year-old male, and He has been diagnosed with a bipolar disorder, and according to the DSM manual, we are able to diagnose him as a patient of bipolar 1 disorder. And according to this diagnosis, we will treat him with majorly with manic medications and antipsychotics medications, and then in low amounts the drug of antidepressant class will be given also. So the treatment of bipolar disorder 1 in this patient will be done in both medically and psychologically. In psychological treatment, there are some therapies like interpersonal social rhythm therapy, and in which a group of people are uh, in a place, and they talk about their conditions. And then there is family focused therapy, in which the family members sit around and talk about the person's behavior and person's state of mind, and try to uh, fix it. And then there comes the cognitive behavioral therapy, in which a person visits a psychiatrist, and then the psychiatrist tries to know the state of mind of the person, and either prescribes some medications, or just sometimes talking therapy is enough. And for the medication, as we all know, atypical antipsychotics are given, mood stabilizers are prescribed, and antidepressants are also given. So thank you.